Sabir Kunju Foundation welcomes you all to the session of Patient Care in Ramadan. Ramadan Fasting and Patience, Dr. S. Abdul Azeez MBBS, DPH. Public Health Specialist. Managing Trustee, Sabir Kunju Foundation. Ramadan Fasting. Fasting from dawn to dusk in the holy month of Ramadan for healthy adult Muslims has been ordained, and physically sick Muslims are exempt from it. The basis of Ramadan fasting. O you who believe, fasting has been prescribed to you as it was prescribed to those before you so that you attain taqwa, self-restraint, God awareness. Quran 2-183. Who are exempted? 1. Physically sick, Quran 2-184-185. 2. Traveler on a journey. 3. Women during menstruation. 4. Pregnant and lactating women. 5. Prepubertal children. Uniqueness of Islamic fasting. It is a voluntary undertaking rather than being ordered by a physician. There is no selective food intake. That is protein only, juice only, fruit only, water only, etc. There is no total calorie malnutrition. That is, it's not a semi-starvation diet. An exercise in self-discipline that is from constant nibbling, drinking, smoking, etc. Psychological effect and additional prayer. Health benefits of fasting. Reduced risks of cancer, cardiovascular diseases, immune disorders, diabetes, etc. Increased insulin sensitivity and reduced insulin resistance, reduced morbidity and increased lifespan in diabetics. Stress resistance, slowing of the aging process and increase maximum lifespan. Weight reduction, loss of 1.73.8 kg. In obese patients. Decrease in appetite and helps in weight reduction. Obese lose more weight than non-obese. Decrease in total and LDL cholesterol, and a decrease in the LDL to HDL cholesterol ratio, resulting in a positive impact on the obesity and coronary risk. Fasting in sick. Expert medical approach and recommendations. Patients who can fast safely. Patients with mild to moderate diabetes, hypertension and other medical conditions can fast safely with scientific precautions. General advice. Consult your doctor first. Practice fasting in Shaban first. With the approval of physician, switch to either long-acting or twice-daily medication. Elderly patients on non-steroidal anti-inflammatory drugs, SAD, should frequent monitor renal functions. Anticoagulant and anti-epileptic medications should be given at night. Patients who should not fast. Diabetes mellitus type 1, pregnant diabetic patients. Chronic renal failure including renal transplant and nephrolithiasis. Severe cardiac and pulmonary conditions. GI bleed and acute ulcers. Severe epilepsy. Severe migraine. What fasting in diabetes? What one should know. Forbid fasting in Type 1, IDDM, diabetic patients. Can fast under medical supervision, if patient desires. Type 2 diabetics, NID, with serious complications. Unstable angina or uncontrolled hypertension, history of diabetic ketoacidosis, recurrent infections, elderly with any degree of alertness problems, history of 2 or more episodes of hypoglycemia and or hyperglycemia during Ramadan, patient non-compliant diabetic regimens for diet, drug, and daily activity. Pregnant diabetics. What a diabetic patient should do before start of fasting. Undergo pre-Ramadan medical assessment by a qualified physician. Adjustment of drug regimen. Proper physical activity. Learn to recognize the warning symptoms of dehydration, hypoglycemia, and other possible complications. Observe the Ramadan 3D triangle. Implementation of proper drug regimens, diet control and daily activity are the 3 pillars for successful fasting. In diabetics during Ramadan. Diabetics should still take a diabetic diet during iftar, sahur and dinner. Is fasting advisable for stable NIDM patients? Yes. Especially for obese diabetics. Benefits of Ramadan fasting in obese. Better control of diabetes. Better control of hypertension. Better control of lipid. 5 to 10 pounds weight loss. NIDM recommendations. Control your diabetes for 2 months prior to Ramadan, bringing the 1C to 8. Discontinue metformin a week before fast. Drugs like glipizide are safer than glyburide and glenide. Continue diabetic diet in iftar and sahur. Fasting for those on insulin. Consult your diabetologist first. Discontinue insulin mixtures such as 70-30, 75-25, or regular insulin. If on NPH, then reduce the total dose by 20% and take 2/3 at iftar and 1/3 at sahur. If on Lantus, then reduce by 20% and take at night, titrate by 2 units, BG 120-140. Take 4-6 units of fast-acting insulin such as Novolog or Humalog before 2 meals. Monitoring for IDDM. Finger stick BG after iftar and before sahur. BG if feeling bad, low. Terminate fast if BS below 60 or over 400. No exercise before iftar. Drink plenty of water at iftar and sahur. Post-Ramadan supervision. After the Ramadan fasting, diabetic patients' therapeutic regimen should be changed back to its previous schedule. Fasting in patients with hypertension, mild to moderate high blood pressure along with being overweight should be encouraged to fast. Hypertensive or cardiac patients. Consult physician to adjust medicines. The dose of diuretic should be reduced for fear of dehydration, and long-acting agents like Indiralel A or Tenormin may be given. Patients with severe hypertension or heart disease should not fast. Fasting in pregnancy. A scientific approach. Fasting in pregnancy. Healthy pregnant lady can fast. No change in outcome of pregnancy or in birth weight in those who fasted and those who did not, reported in Gambia. Allow time to rest, and stay away from stress and anxiety triggers. Get the right nutrients and enough calories. Take the sahur meal as late as possible. Break your fast gradually, by eating one small meal slowly, instead of the one big meal at once. Drink plenty of fluids, 8-10 glasses of water each day. Try to eat easily digestible animal proteins such as red meat, chicken, fish and eggs. Eat plenty of fresh fruits and vegetables including leafy green. Eat dates or dried dates to ease constipation. Cut back on carbohydrates and fatty foods. Avoid certain foods like pickles, spices, coffee, tea, carbonated water and sweets. Pregnancy is not a medical illness. Pregnancy with complications. Do not fast in any of the following conditions: diabetes/hypertension, chronic kidney disease, malfunction of the liver, bronchial asthma that requires an atomizer, twin pregnancy, risk of premature labor, severe pregnancy sickness. Children and Ramadan fasting. Keep the young fasting children from sun exposure to avoid dehydration. Encouraged to take more fluids in non-fasting hours. Do not take excess coffee, tea, carbonated drinks. Long-time benefits of fasting. Facilitates detoxification process. Eliminating or neutralizing toxins through the colon, liver, kidneys, lungs, lymph glands, and skin. Slows down metabolic rate, leads to more efficient protein production, improves body immune system, and increases the production of anti-aging hormones such as growth hormone, enhances rejuvenation and extend your life expectancy. Wishing that this Ramadan, Allah answers all your prayers. Ramadan Mubarak.